It's a home run.
All right, thank you very much. Welcome to everyone for the third in our webinar world series, which is asking, is digital physical rehabilitation a home run? And I am Wesley Fogel. I am the co-founder and CEO of On the Mend. We are a digital platform for people recovering from an injury or surgery with physical rehab that is motivating, personalized, and driven around the individual needs of each patient, allowing patients to be supported by healthcare professionals who can deliver care that is driven by real-time data on their needs. And today we are shifting our focus away from the systems and the technologies that we've been having some fascinating discussions, both from the UK and the US perspective, and instead putting the spotlight on where it really belongs, which is on the people who are using these technologies. And this session is about what digital rehabilitation really feels like from the patient's point of view, what is working, what's frustrating, what needs to improve if digital rehab is really going to deliver better care. So introducing our panel today, we're lucky to be joined by four brilliant speakers who are bringing both professional knowledge and personal experience. We have our lead physiotherapist, Nicholas May, who has been advising On the Mend and specialises in trauma and orthopaedics and works closely with patients and clinicians on how rehab is delivered. We have Sharon Court, patient and public involvement facilitator at Portsmouth Hospital's NHS Trust. Sharon helps make patient voices heard in research and care decisions. We also have Darren Jenkinson, the chair of the Patient, Family and Carer Collaborative at Portsmouth Hospitals, and a patient research ambassador who's lived through his own digital rehab journey. And finally, Jenny Gould, a member of the Oxford BRC Patient and Public Advisory Group, a former psychotherapist with her own orthopaedic recovery experience. Jenny works on national research about pain, care and communication. So today's discussion is going to be around five main themes. Firstly, how digital rehab empowers patients. Secondly, why access and usability still needs further work. What builds or breaks trust in these digital care tools. How remote monitoring really feels like from the patient's side, and what patients want from the future of digital health. So I'm going to be going one theme at a time and ask a few questions to the panel and hopefully keep things quite conversational and hopefully leave time for questions from anyone at the end. So let's get started on the first theme of patient empowerment through digital tools. So we like to say that digital rehab gives people more control over their recovery, but what does that really mean in practice? And how can we make sure that it feels like support and not pressure? So I will start, if I may, by asking Sharon a question. So Sharon, how do you see patients describing really the emotional benefits of feeling more in control of their recovery with digital tools? Thank you.
I think it definitely helps patients to feel that they have more agency. Being ill, being unwell, having had an accident and requiring treatment takes a lot of control out of your hands. And so having the opportunity to take some of that control back is incredibly helpful and empowering for patients, I think. The other place where it becomes very helpful is in the relationship with your clinician, your consultant, whoever's treating you. There are certainly cases, I think, where consultants have an almost parent-child relationship with their patients. The consultant knows everything, you don't, you're supposed to get on with it and do what you're told. But I think the introduction of digital tools has shifted that balance slightly. And I think newer generations of clinicians and practitioners are also more open to an equitable conversation, which again offers more agency to patients. So I see that it creates opportunities for a conversation, more of a shared conversation about treatment, rather than a why haven't you done the thing you're supposed to have done kind of approach.
Understood. Thank you, Sharon. And just maybe if I follow up, in terms of when patients help with the design of these types of solutions, what do you typically find patients are asking for, kind of features or other things like that?
Depends on on the condition, because I've supported people who are developing apps for all sorts of things, but a lot of it's about feedback. How do I know I'm doing the thing I'm supposed to be doing? It's about the ease of access, the tools and so on that people are using. Where would I find this button? How will I find that? It's about making sure that the app or the tools that you're creating are intuitive, which is hard because everybody thinks differently, but we are used broadly to looking for certain sort of symbols, icons, pictures, layout that make things feel more familiar. So that when you download a new app and you think, oh, where am I going to find this? The instinct is, where are those little buttons or lines at the top of the page? Where's the help at the bottom? We get used to a certain amount of formatting that is similar across a lot of different apps. So having an app that presents itself with some of those similar features and layout helps people to get into it a lot more quickly, and then they feel like, oh, okay, I can get to this. This makes sense, and I know how to do it.
That's great. Thank you very much, Sharon. And maybe, Nick, if you just wanted to touch on, I think Sharon mentioned about this parent-child relationship and moving away perhaps from the following instructions mode to being more of a teamwork-based approach. How can we enable that to happen, Nick?
Well, I mean, I think it was a really great point. Firstly, good morning, everybody. Sorry. I think it was a really great point that was made, actually, because when you're injured in some way to any degree, you become vulnerable. And whenever we are vulnerable, the inner emotive child side of us comes to the surface. In hospitals, we traditionally reinforce that by putting people in bed and we tell them when to eat, when to sleep. And we take excellently functioning adults and we reduce them back to a childlike status of dependency. And to be honest, it's very patronizing. It's well intentioned, but it's very patronizing. And I think one of the important points that we as clinicians can help patients with is to empower the rational adult, the logical, the successful person that has presented to them. And part of that, I think, is helping to get to know who they are. One of the things that's really empowering for a patient in hospital is to get to talk about who they are when they're well. What's their normal life like? How we use digital tools in that respect is, I think, is we as has been mentioned, we move them away from a model of compliance and one towards more of collaboration. When I was a student many years ago, we were taught about the patient locus of control and how that becomes very narrow and small when they're going through a period of illness. And I think also just at the point we receive them in our care, there's a patients have been on a journey to that point, and it's an eroding of their resilience, both physically, emotionally. And I think what's important is to help patients to understand where are they in that journey, which aspects of their resilience have been reduced more than others. How do we engage in it? How do we become responsive to that? And in terms of digital tools, then you need tools that have the flexibility to be responsive to that. I like the idea of championing patients to become a quarterback in their own rehab. They get to choose who they add into their network. They get the empowerment of adding them into their network. That creates that continuity of care. It enables that sense of restoration of locus of control, empowerment of self-monitoring, and helps them to. Patients themselves are very intuitive. We talk about apps being intuitive, but patients are intuitive. They invariably know what's right and what's wrong, and which bits are going well and which bits are not. So we just need to give them the tools. But I think, as Sharon perfectly said, is how do we have that responsibility to give them digital tools that are intuitive, that are user friendly, and to help coach them, not patronize them in terms of what they need to do to get better, but just coach them in the tools to use it themselves. And I think the more I like to think of these tools as virtual assistants. We use virtual assistants for so many areas of our life. But actually, the idea that a rehab app could be a virtual assistant to a patient, but the patient is still the one in control of it, and it gets to shape the app to how best supports them. That's how I think we can empower them the most.
Interesting. Thanks, Nick. And maybe to Jenny as well, in terms of maybe the products might be intuitive, but in terms of how they're designed, but how important is there to think about the language of how these are introduced to patients when they're encouraged to try to use them?
Well, it's very important, because language and communication is everything, really. How you say something has such a massive effect on how someone perceives it. It has a big impact on pain and recovery, there's no doubt, and wellness generally. It can be motivating and reassuring and comforting, or it can make you feel a bit hopeless or deflated and like a failure. And we all know what it's like when you've got a bad teacher at school. You know, it's obvious to us all, really. I think the language should be informal. It should be day-to-day language, absolutely. It should be friendly, it should be engaging. This is not, as you say, the parent-child relationship. This is not official. This is your friendly, helpful app, if you like, person on the app. And whether it's a person or a bot, I think sometimes, you know, AI can be very helpful in making people feel this is a personal relationship. I'm not an expert on that, but I've actually found it to be certainly better than nothing. It's better than not having that sort of interaction. I think, language can make a big difference to whether you see something positive or negatively, but it also can, you know, affect your expectations and your goals depending on what the person has expectations or the other person's expectations of you, and it's how you negotiate those between you and I think having the time to go through the app with somebody is very helpful. If you're still in hospital, taking the time, demonstrating ease of use, and just having somebody on your side, really. I think if it's too early in recovery, many are not ready. I think there's too much going on. They're overwhelmed, and particularly in the trauma, which is where a lot of, I'm not involved in the trauma wards, but a lot of the research I'm involved with is musculoskeletal trauma, and it's very overwhelming. So they would need, if you're going to introduce it early, it needs to have a particular style, a very empathic and supportive style, and simple, not complicated at all.
Okay, thank you, Jenny. You might come back to some of those themes and ideas as we go forward. I think, Darren, I just wanted to bring you in. You've used a digital tool in your recovery. I wondered how that helped you to take ownership of your condition.
Yeah, thank you, Wesley. What particularly helped me was entering my data into the digital app I was using, My Renal Care in my instance. It helped me have a better understanding of what my condition was, and looking back through the app of previous entries I'd made, it then empowered me to be able to find a route that was best suited me and my condition, so I could get the best out of it. So, for instance, in my case, doing dialysis, I could work out what time was best for me to get the best results from that, and also using that to help me dialyse in places that I wouldn't have thought about to begin with. I dialysed on a car, on a boat, and in many places. But using that app, I could see that if I did it at a certain time and then followed up at another time with a second app, it could still be just as effective. So it gave me that feeling that I was in control, and that I wasn't just having a limited view of what I could do and where I could do it. I don't think it will necessarily work for everyone, but those people that are willing to help themselves and want to get engaged, I think that is the point. It's apps are only as good as Jenny was saying, with the relationship with the team you have. I was very lucky. I had a very good relationship with my renal team, and I don't think it should be used as somewhere to just put people out and not engage in that person beforehand, because that's just as important, so that you feel confident still in the team. And I think that's something that shouldn't be lost.
Interesting. I mean, is there anything there, Darren, to help and maybe feel like you have an active partner in your rehab through these tools? Is it the right way to describe that?
Yes. I used it to change the way that I was doing my dialysis, and in many other ways. For instance, on the particular app I was using, it came up with my blood results, and doing that being someone who had chronic kidney disease, I had already been told by my dietitians what certain conditions, i.e. my potassium had risen or my calcium, what I needed to change within my diet to actually bring those down. So I got that blood result the next day. I knew what I had to do if I saw a change, and I did that myself. It meant that I could choose what I wanted to take out of my diet instead of a dietitian telling me. And it also meant that after a period of time, the dietitians knew that I knew what I was doing, because they could see that I was changing my diet and it was affecting my blood results. So they didn't need to follow me up. So again, it just made me feel like I was the one driving my own condition, but also having the support of the app if something was going wrong.
That's brilliant, Darren.
Yeah.
Here. I was just thinking down about what you were saying. A huge amount of what you're talking about actually is quality of life. Because once you understood more about the routine you needed for your dialysis, and you talked about being able to dialyze in different places, I imagine that for some people, they would think, I can only do this at home. And so suddenly their world is reduced to a 4-hour window. I can only do this in these places, and I'm stuck with that. And then everything else gets compressed. But what you've been talking about is I can make choices. They're informed choices. The app backs up what I'm doing. It tells me what I can do and what's safe to do. And now I can choose to go out, and I can be out for several hours, and I know I will be okay. I know how to manage this. I know how to do it. I know how to look after myself. I know how to make good choices. So in that sense, as Wesley was saying earlier, it's an assistant, it's a support, it's a backup team that says, these things are okay. You're all right, you can do this. And it restores some of that autonomy and that focus of control, as Nicholas was saying earlier. Yes, you can do that. Yes, you can. You can take more ownership of your own recovery because the app provides that extra reassurance, which is brilliant. But you're also right about engagement, because there are some patients who will take hold of that and they will gain more confidence as they use it. But there may be other patients who just think, I can't do that. I'm going to get it wrong. I'm going to make mistakes. And so they won't. They'll back off. And that leaves them in a more dependent space. But whether they recognize that or not is perhaps a different question.
And I think this is where patient expert groups can be so helpful as well, because there's nothing quite, I imagine, as reassuring for a patient as seeing another patient who's adapted to something. You know, it takes the clinician out of it, doesn't it? It's something where patients can support each other with this, and that's an incredibly powerful tool as well.
I'm 100% with you there, Nicholas. The renal unit get me to talk to other patients that are just been told that they need dialysis, especially those patients who they term as crash landing. They've just turned up at the unit, out of the blue, they've been told that they need dialysis and a transplant. It's a huge world-changing event for that person and for their families. And so I give them my perspective. I talk through my process and how both dialyzing itself and using the app in combination with those has helped me become less reliant on the unit and can do more things than you would expect. And I think all the people I've talked to, without exception, do feel a lot better having talked to someone who's been through it. And it also gives them, I give them the time. A renal specialist has got maybe 10-15 minutes, and then they've got to go and see the next patient. It's not their fault. They don't want to do that. It's just the way it is. Where talking to people over quite a long time with people, you know that it takes them a while for their real fears and worries to emerge, because it is so overwhelming. And so once you've talked to them for a while, they start then opening up about what is really concerning them and their family members, because it isn't just about the patient, it's about all the people that are around them, and that will definitely improves their quality of life, even in the short term before they start using that. And I think you're right, Nicholas. Apps really need to have some sort of way where patients can communicate with each other through the app, as long as they've given consent, especially if they are at home alone. I imagine for elderly people, using an app can feel quite isolating. I don't know about the rest of you. And so maybe having somewhere on a future app that someone is developing where they can have a link, where they can message each other, would benefit everyone. Obviously, though, they'd have to get consent from them. And maybe if they then got consent for the people that were actually running the apps to record those messages, they might be able to get some things from that to improve their app. Because patient involvement in improving, which My Renal Care has been quite good at over time, is vitally important.
Thanks, Sharon. I think I was going to put a wish list of things towards the end, but maybe stole a bit of the thunder there. But if we could,
Sorry.
I think that's good. I think we almost don't need a moderator for this discussion. It's really, really good to hear that. I think just in terms of another theme to cover in terms of accessibility and usability challenges, and I think you've already said, Darren, that apps are not for everyone, and I think also, Sharon, you've mentioned some of the limitations, but we know that digital tools are not one size fits all. Older patients, people with complex needs or unfamiliar with technology might face other barriers to adopting these technologies. And also, if the design isn't right, then even the best tools can be a poor fit. So maybe, Sharon, just to kick off this idea, what challenges do older or less tech confident patients face when starting digital rehab?
I think partly it's intimidation, actually. It's the sense of, I'm going to break this and I don't know how to fix it, and I'm going to feel stupid. So if I don't start in the first place, I can't get it wrong. There's also issues around digital poverty. So one of the members of the PRA group has asked me to print out the documents that I might send out for the research meetings that we have. And I thought about that for a little while, and then I realized it's because they don't have access to a computer or a laptop. So they get everything on their phone. They can get email, they can get their appointments, they can get their text messages, but they can't access the documents because they're so small on the screen they can't read them. And this person hasn't said this to me out loud, and I haven't pressed them on it. I'm very happy to send them printed copies. That's never an issue. I want people to be involved, and so I will do whatever is necessary to make them feel involved. But it occurred to me there's an unspoken assumption that, oh, well, if you can access your emails, you must have access to a laptop. And that's not the case, or a computer. And there are some people who are very anxious about their data and how that might be used. And, well, what are you going to take from me if I have it on my computer or my phone, and how is that going to be used? And so data protection and the use of data is really important. As Darren was saying earlier, people must knowingly, whatever information they're sharing, it must be done with informed consent. So I think there's lots of those sorts of different things humming in the background that might create barriers for people. And also with digital poverty as well, again, taking the example of Portsmouth, during the lockdown, schools were scrambling to get laptops out to children because we have high levels of deprivation across the city. And they knew that there were families that had no laptop or computer or access to it. They knew there were students who were attending those online lessons on the phone, where people had a pay-as-you-go contract, so all the data was getting sucked up. Maybe they had no access to Wi-Fi, but these things are hidden because there is an assumption that everybody can, so everybody does. But that's not necessarily the case. So in the terms of the app and how that would work, it might need to be constructed in a way that makes it data light. So if there are links to things online, or there are short videos and stuff like that, is there a way to enable people to access that isn't going to have a big impact on their data or how much data they need to use? Is there a way of doing that at a lower resolution so that it doesn't require so much energy or download speed or things like that, so that it makes it as widely accessible as possible? I'm not sure that's entirely answered your question, but hopefully.
Yeah, it sort of almost answers some of the follow-up question I had, which is how the carers or family members could be helped to support the adoption of these tools.
And I think that is where that comes in really helpfully. And again, Darren mentioned it earlier, and Jenny, I'm sure you've got your experiences as well. But actually, no patient is isolated. Well, no, that's unfair. Some patients may be isolated if they don't have any family or friends living nearby. But where people do have family or friends living nearby, then those are the people who might help them overcome those initial reservations. Those are the people who will say, I'll sit with you, I'll do it with you. What did the nurse say? What did the physio say? Let's go through it again. Let's have a look at it. Those younger members, those grandchildren and nieces and nephews who are like, yeah, I know how this works. And suddenly the whole thing is open. Oh, it's like that. That's great. And I'm not that old and my children are still explaining things to me. But yeah, I'm taking advantage of other generations and their intuitive response to digital technology can help to bridge that gap.
That's great. Thank you, Sharon. And I think it was also, Nick, it was also raised earlier, I think by Sharon, about the timing of when to introduce these technologies. When is the best time? When's, in your experience, that timing issue?
Well, along my theme of usually having a rather bad analogy to try and summarize it, and for those people that can remember it, I tend to refer to it as Morecambe and Wise syndrome, because they had that wonderful sketch where they talk about getting all the right notes, just not necessarily in the right order. And I've always found it a very good summary of an effective healthcare recovery. If you get the right notes in the right order, the tune should be as melodic as one could be expected for a patient. And I think for some, the timing of data introduction, sometimes it may be when they're physically ready, particularly after major trauma, or more often than not, when somebody is in an adverse situation, they are so focused on coping on the straight and narrow that any challenges to deviate either side of that, which they would happily adjust to ordinarily under other circumstances, they become a big challenge, and it can easily knock someone out of that emotional and emotional resilience zone that they're needing to stay in to survive at that moment. So I think the key things around the timing of it are certainly, when is it going to add value? That's the most important thing. Is we don't just want to add something in the mix simply because we can. It has to add value for a patient, and sometimes that again, that's where the conversation with the patient is. Informed consent is there for that reason, to say, look, here's a tool that may work well for you. Here's how we think it may work well for you, but when do you think it will work well for you? I think as part of that, a good time to add it is when there's support readily available. There's, in increasingly orthopaedic circles now, where the pressures on orthopaedic departments mean patients very often don't get a huge amount of follow-up to, following certain, trauma events. To give them an app just as you're about to never see them again is not to the right time to introduce something. So I think giving it in a time when there's plenty of support available, as very well said just now, not just when they're available, but when family members might be available, because you want the families contributing to the recovery, and family members also often have a lot of nervous energy that they want to put to good use but don't know how. And sometimes then that will come across as just simply, well, if I fuss the patient, nothing bad will happen. And I've been guilty of doing that with my mum, and I'm sure we all have. But if we know how to put our energies and play to our strengths, and again, it's just understanding the landscape of a recovery for a patient and what they're going through, and who's available to help in certain ways. And I think the other part there around the timing of these things are, it was a very inspirational physio I know once, and not meant to be in flippant terms, but every medical event in some way is a brain injury, because there's a certain amount of cognitive and emotional adjustment to whatever circumstances you're going through. Therefore, there is a certain challenge to the brain to recover and help cope through it. And I think that's quite seen in those terms. It's not obviously not meant to diminish the severity of physical brain injuries, but certainly it just highlights the important need to consider the cognitive and emotional sides of things for patients before we ask them to take on a new intervention. And certainly an intervention should not be seen as an additional. It's not meant to be another thing on their list to have to cope about. It has to be made clear what it benefits and how it's going to replace something else that is seen in an advantageous way for them.
Interesting, Nick. And I guess just to maybe cheekily take your analogy a step further, much like playing the notes in the right order, maybe in the way you learn a piano, everyone has different learning styles, and how we can design tools that adapt to different learning styles from individuals.
Mm-hmm. And I think the follow-up part is really important, actually. So one of the things that we'd been discussing via email before this session was about how widespread apps are in the NHS and how much practitioners are using them. And in my personal experience, both myself and my daughter went to see a physio for different things. And they said, oh, that's fine. We had a consultation, 10 or 20 minutes, very friendly, nice informal chat. We were seen quite quickly, which is nice because we understand there's a lot of pressure on waiting lists and services in a lot of places. And they talked it through. They said, okay, this is what's happening. This is what's going on in your body. So these are some exercises you can do. I will send you the links. And so then we got links to things on YouTube. And then they said, if you need us, you can follow up. But there isn't necessarily any follow up. And there isn't anyone who is kindly and politely saying, did you do the exercises I sent you? Did you do them? And both my daughter and I say we really should do those things that they sent us that we haven't done yet. So it's not just about knowing what to do and when to apply that, but also where is the follow-up that pokes you gently in the ribs and say, come on now, you can't complain about this ache and a pain if you're not going to do anything about it. And it's that relationship that physicians really want to be able to give their patients that they don't have capacity for, but perhaps that might be a space where digital apps might link up with that clinician and say, so-and-so hasn't logged on for a month. Do you just want to check in? Quick phone call, quick email, practice nurse from the GP surgery, just checking in. How are you getting on? Do you need to pop in and check and chat with somebody? Do you need to go back on the app for something? And just that little 5-minute phone call might be really, really helpful in that patient's overall recovery journey. How practical that is, given I don't work in a GP surgery, I don't know, but it's that sense of continuity, because otherwise things drift and they drift and they drift. And does it happen? Does it work? Do these things get followed up in the way that they should be? I mean, Nicholas, you're a clinician, so you know how this works. And people who come back to you and say, it's not working, and you look at them patiently and say, did you do any of the things I asked you? No? Okay, let's start again. So there's that sense of, I want to help you, but you need to help yourself as well. And maybe that's the space in which digital rehab might sit.
Absolutely. And I think that it's one of the hardest things to learn after you've finished studying to become a physiotherapist, that most of the things that ought to work from the textbooks rarely actually work in practice. And that's because the human element is added into it, and human behaviors and how we all react in different ways to pain, and our belief systems around pain, or the sense of vulnerability, how we all react in those situations. Everybody is unique in that way, and that's where a recovery plan or support plan for people that is very much adaptable and flexible to their individual needs. But as we said at the start, the most important thing is that the patient is not seen as a passive dependent upon in it, and it circles entirely nicely with that first conversation we had to say that patients need to be empowered and treated as the successful humans that they are, with the capabilities to adapt to it as well, rather than capping their potential for recovery by simply talking at them instead of with them.
It's interesting though, isn't it? Because I've just come through having my knee replaced second time, basically, so a revision knee replacement 8 weeks ago, and it's all very raw for me still. And you talk about empowering people, and that's great, but the last thing I was interested in was in that first few days was being empowered. All I wanted, this is why it's important for us to talk about how if you can introduce these things early on or not. I just wanted someone to look after me. I wanted someone to care about me. And I've found that, unfortunately, distinctly lacking. I did feel on my own. It was like everybody was very rushed. I asked someone a question, why am I having these IV antibiotics? And then why am I having another one and another one? Nobody knew. It's like, I don't know. I found out on the third day that it was because all knee revisions under this consultant have all these antibiotics. But I thought maybe there's an infection and they're not telling me. Why aren't they telling me this? So it's just that basic human interaction and connection. Somebody, because there's so many staff, you don't get the sense there's anybody for you. There's anybody really like your person. And it's all down to that, really. It's all down to feeling that then you can go on to feel empowered if you've got somebody who like gives you that idea that you are ready to be empowered, that you know that you can do it, as we said earlier. But I felt extremely vulnerable, and I've never felt so ill in my whole life. Unfortunately, I had a reaction to the tramadol and things, so I was quite poorly for a few weeks afterwards. But it's a real wake-up call when you are in that victim position, because you're lying down for a start. I couldn't even get up because I was dizzy and sick. It really brings it back to you. And I know I've spoken to patients or clients, I call them, so many times about how to cope with pain and how one might visualize this and that, and all that. And actually, in the midst of it, when it's that bad, there is nothing that works.
No.
It's a really great point. Actually, a question I'll put to Darren in a minute, if I may. Actually, is I think that's such a relevant point, Jenny. And I noticed that some of the small, not smoke and mirrors, but some of the small subconscious touches that goes on in hospital sometimes are, you see the orthopaedic surgeon who will always come on the ward, irrespective of how long his operating day has been. He will always come on the ward looking immaculate in a good suit, making light, making light of what he's just done. And most surgeons do that; they make light of what they've just done, even though what they have just done is really the embodiment of their life's work. But they always
it all went very well, Mrs. Gould. It all went very well. Don't worry your little head about it. You don't need to know the details.
And they will always say, it's the physios you really need to spend time with, the nurses, they're the ones that really matter here. And there's a reassurance you get from some of that. Or I think I mentioned in the previous webinar that I remember a very good cardiac surgeon who would say he roughly knows what he wants to do with most patients before they come in the room, because he has all the information he needs. But he'll always make a point of listening to their chest so that he can put a hand on their shoulder that's reassuring to them. And I think that definitely is very much where the digital tools do not replace the human. The digital enhancement doesn't replace the human. And my question to Darren was actually, is that as you became so expert in your own needs and care in that way, Darren, did you feel that you lost something? Did you have moments where you felt you lost from any clinician interaction?
Well, I suppose what I felt I lost is time for doing other things. Because you spend so much of your time looking after your own health, the rest of life, which the things in life that make life worth living, sometimes can get drifted past you, and it's also a case of that you still need that interaction with the clinicians involved. And like Jenny was saying, I do real-time feedback within the hospital, talking to patients, and the biggest single complaint we get is communication. Some nurses and doctors are very good at it, some aren't, and it's not helped by the fact they're in such a rush. And it's not just about communication, it's the right sort of communication. I think that's where an app can help, if it can link you to good information about your own condition. Because if people aren't getting that information, or it's not even if they aren't getting it, if they're not getting it in an understandable way, for instance, then they may then go on to Google and Google their condition and come up with, there is so much bad on there. That that is, I think, is going to be part of the app's importance, is giving the right information, and as you said, at the right time. And that is going to be quite difficult, because people have different conditions and they have different ways of learning. And as Jenny said, I had both of my hips replaced quite a while ago, and I had bilateral vascular necrosis of the femoral head, which is very, very painful. So they gave me a talk before, a big group talk about what's going to happen, but I was in no condition, because of the pain I was in, to really absorb that. Although after the operation the therapists were very good, again, I was more interested in trying to get well than actually absorbing things. That's where an app again could come into its own when you're at home and you're starting to feel better,
Absolutely. Yeah.
reminding you of how to do the things that you're supposed to in the right way, by maybe having videos of certain exercises you've got to do, but when you do that, you tailor it to the condition that patients had, so you link them to those videos. And I think that's where the interaction between patients and clinicians and the tech people actually designing and making the apps is so important.
Can I just say that when sorry, I'm terrible for interrupting. I should really have continued on to say that after I was at home and still unwell for a few weeks, that's the point really where I could have benefited from an app. For example, you don't want to ring your GP all the time, because for a start, you'll never get a face-to-face for a couple of weeks, and you'll speak to a different duty doctor who's trying to read your notes at the same time as listening to what you're saying. So really, if you had an app that said, this is okay, it will feel like, for example, I didn't know how I was supposed to sleep. I didn't know if it was okay to sleep on the left side or how I should. And I actually did Google it, and it said, never sleep on the side of the injury. And then when I finally asked somebody who knew, they said, no, it's fine. You are allowed to sleep any way you like. I thought, well, that would be handy to know. So that's the sort of thing you could have on an app that would reassure you, in the same way as it might say, your wound is okay if it looks like this. Look, I know that's somewhere in the written leaflet, but we put the leaflet aside. We don't know where it is, but I do really think that that could be really helpful.
Is there a risk in any way at all with being able to monitor one's own recovery, whether it's the wound or whether it's any particular readings? Is there a risk that it becomes a little bit obsessional? I know that if I'm wearing a wearable when I'm running, I'm forever looking at my watch to see what my time. Is there a risk, and how do we guard against that? I wonder.
I think wearables are worse. I think a wearable is worse. I know how many steps I've done today already, and I didn't even have to look. So yeah. But I think if it's something you've got to log into all the time, you're less likely to.
Yeah. So there's something there about needing to actively choose to engage with it that might provide a buffer zone that says, do you need to do this right now? You checked in earlier. You're okay. It's fine.
Yeah.
So there's something about the action of having to check rather than that information being there instantly. Wesley, I was going to say things for your wish list would be, what should I expect if I've had this surgery or this physio or this treatment or this kind of trauma? Yeah. What's within the bounds of normal, given that normal is a big space? What should I expect? What seems normal? The other one would be access to reliable sources of information, which you probably got in there already, but so that we can avoid the Google search. My mum years ago had Reader's Digest Encyclopedia of Health, and she said, never read that, because you'll have everything. You'll have everything that they've possibly got in the book. And Google, I think, operates as the digital version of that. So finding ways for people to access reliable information, and also, and this would be tricky to be fair, but making sure those links are up to date, so that when you go and say, yes, look here for this, and you find it's not there anymore. That's a tricky one, to be fair. But yeah, that reliable sense of information. What's normal? What's reasonable? How should I be feeling? How might I be feeling by week 8 of something?
Exactly.
Is really useful.
Yeah,
it provides some context.
Yeah, I mean, you can get all sorts of sensations with these big operations when they're healing, and you might suddenly get a sort of feeling of electric shocks going through, and you think, my God, what's that? Is something. But if you know that it's fine, these different sensations will come and go. You accept it.
Yeah.
So it's very important.
From a practical point as well, if you're always in a constant heightened sense of anxiety, then you've got much higher levels of cortisol going around your system, which impedes your immune system, and it impedes your healing process, which is going to just take this whole process longer. But if you can feel less stressed and less anxious because you think this is kind of normal, this is okay, I should expect this, that's really reassuring. And then for patients, it's like, okay, I don't need to be stressed, actually. It's kind of weird, because of course it is weird, but also it's okay. It's weird, but it's okay.
Yeah.
We need the keep calm and carry on section.
Yeah.
on the My Renal Care app that I use, you could send a picture in. So, for instance, I had a PD tube coming out, and you could get infected, or it may just be a rash or something. And I did use it on a couple of occasions when I wasn't sure. And they'd phone me back and say yes or no. That's after the doctor had a quick look at it. That then reassured you, and then in the future, if it looked like that, it was okay. But then if it didn't, then you would send another picture through. So that did help me. But you're right, it can become quite obsessive if you let it. And probably I was one of those people that maybe over did all the notes and things that I did. But that is quite difficult. It all depends on the personality of the person, isn't it? Some people want to know every single thing about to the minutest detail, and other people I really don't want to know. They just want to know they're feeling better. And I think that's maybe where you have on the app a bit where you click. We've mentioned this before, Sharon, haven't we? Where you have the basic information, and if you are the person that wants more, you click on a link to get more information. Because we're all different. We all have got different needs, and an app shouldn't just be about too general. If it's going to work for everyone, there needs to be some form of the patient being able to pick what they need out of it.
Well, Darren, that's actually a perfect point for me to ask given how long we've really fun, and time does fly when you're having fun. It's a really great thank you, everyone. But there is a chance to kind of maybe fold in a couple of themes in this question. Everyone might just chip in on this in terms of how innovators like ourselves can build in empathy and really understand the needs of the patients who they're trying to help. And if you might be able to offer some suggestions on how we can build in empathy, and in addition to which maybe add in, as Sharon just mentioned, some of that wish list as well. But I'd like to focus more on the process and the methods by which we come up with these solutions. Maybe Sharon, would you like to go first?
That's really interesting. And I've been reflecting on what Nicholas has been saying about the experience of the practitioner. You've had all of this training, you know all of this stuff, and then you meet with real people and they don't behave like they do in the books. And why is that? Why are they not doing the thing and complaining about the fact they still feel unwell? So empathy comes out of relationship. And I don't think you can make a relationship with an app. But if you do know that the app has been designed with the input of people who've gone through this process and people who've treated patients in this process, I think that helps to begin to create the sense of, oh, this is real people. Real people have done this because they've come from this experience, because they understand it, because they get what it feels like. So maybe perhaps within the app, there's a space that said, who was involved in this? And you have we worked with patients from all across the country, and they've given us their experience and their understanding, and it's really helped us to tailor what we offer to the patient's lived experience, because that's where it matters. And this is one of the areas that is a key part of my role within the NHS, and it's something that Darren is also very heavily involved in, and Jenny, you will be in your role as well. It's getting all of that lived experience and making sure it meets with all the clinical knowledge and research and academic experience to make sure that those things mesh together. Because academic knowledge and experience and research is brilliant. And it may be that we've met all of those clinical targets. We've done the surgery, we've ticked all the boxes, we've done all the things we're supposed to do, but each person will experience that same surgery in a slightly different way. And they will go home to a different context and a different set of circumstances, and they will have come from a whole lifetime of different experiences and different circumstances. And that's where you get that discordance sometimes, where you have a dissonance between the clinical outcomes and the physical outcomes, the patient outcomes, sorry. So you've technically done all the things you're supposed to do, but the patient's feeling lost and they're a bit confused and like, I don't even know if I'm doing this right. I don't even know if I should or shouldn't be doing this. That's where, in the wording, as Jenny said earlier, in the language, in the way that it's structured, it says this is driven by patients. Patients have been through this, they've understood it. And Wesley, this is how you got into this in the first place. because of your personal experience and that sense of, I want to do this better because I'm sure we can do this better. And most entrepreneurs that I've met and worked with over the last few years have come into the space they're in because of that personal experience of, we can do this better. And I want to help the NHS do this better. I want to have patients have a better experience. That's what needs to come through in the design, in the wording, in the language, in the layout of the app that's being created, so that people see it doesn't come from I could make some money out of this, but actually it comes from this was my experience and I want to make things better for other people. That's how you start to create that. And you can tell things that are written and designed by people who've lived through something just have a different kind of quality about it. And you think, oh, okay, they get it. There's something in the language. I'm sorry, I'm not being very precise, but there's something in the language and the way it's put together. You think, oh, they've been there. They know what that's like. And I think that's what makes the difference. And that's what resonates with people.
Thank you, Sharon. Nick, how much does that resonate from your physio perspective?
Yeah, I think absolutely. I think the things that really make a difference now are, as we found with the development of On the Mend, is things you think are going to go well that actually it's like when you're doing research, you basically create a null hypothesis where you basically aim to prove yourself wrong. The thing you think is going to work, go out and prove yourself wrong. That's the best way of challenging it. And for us, the patient focus groups and hearing from patients have been absolutely critical in understanding great ideas that are actually not great ideas. And I think in terms of the things that are going to work well going forward for healthcare generally, I think in regards to digital technologies, we've got artificial intelligence and machine learning and all these wonderful tools at our disposal. But if the clinicians don't understand the technology side, and then how do we use technology in a good way? And if the patient's not involved in the process, how are the clinicians going to understand what really matters to the patient? It needs very much a collaborative approach between patients, clinicians, people that understand the technology, and also what's practical. Some wonderful medical regeneration of knees and various things over the years have fallen by the wayside, not because they weren't great, but because they weren't pragmatic and affordable. And that's the other thing is creating solutions. The affordability in this being, will the patient buy into it in terms of engagement, and can they use it? And that's that kind of equity is so critical to all of this. So I think I absolutely agree with Sharon that these things are very much about understanding the landscape and shaping it across a collaborative way that the patients are at the heart of.
Thanks, Nick. Jenny, is there anything you'd like to add? No.
I agree with all that. I think it really is to remember that we're all much more intuitive than we think, and we can read people even across screens. We can read people fairly well, and we know if someone, as Sharon said, we know if it's a genuine caring approach to something rather than just a plastic mask we put on. I think it is about dovetailing that the clinical staff, the real people, with the AI, with the information, getting that all three sort of aspects of it. But you need the clinical staff to listen. You need, as Nick mentioned, I think it is actually listen to what people are saying. They need to be heard, and it has to be designed for someone like me. So everybody, you have to, whoever you are, whatever cultural background you come from, whatever age group, whatever socio demographic, etc., it's got to be somehow able to speak to you. Because if it doesn't, you'll lose interest. You'll think this is meant for people more intelligent than me, or, people like this or people like that. It has to feel, that intuitive thing. I think patient stories are good. I think using sort of metaphors, using, images, color, all that appeals to us emotionally, feels friendly, doesn't it? Feels like the friendly voice. And that's a real art, I think, to get that balance right, because if you have too much color, too many icons, obviously it's overwhelmingly visual. And since we all learn differently, and somebody might like a very clean look, somebody might like a more chaotic look. You can't please everybody, but it's how do you incorporate enough of those elements to be the right balance for Yeah, for most people, I guess, unless you're going to completely tailor make for all every kind of eventuality, which then you get to the point where you're doing tailor made for an individual.
Yeah. Well, I'm just thinking of offering chaotic color schemes for people who want them.
Yes.
Yeah, we can think
Yes.
about that.
Yeah.
Darren, would you like to close out? Any final thoughts from yourself?
Well, a couple of things. What Nicholas and Jenny said about collaboration. Collaboration is key. It's not just the patients, their voice being heard, but it's the clinicians as well. Because both ends of that are very important, and they've both got to feel like they are involved, not just in running the app, but improving it going forward. Because just as a patient might come up with something that they think, oh, that's not very good, if they did it this way, there needs to be a pathway for them to actually do that and say that. The clinicians and the nurses that are the phrase talking to the patients, starting this off, they might say, well, that's silly. Most of the patients I've been talking to don't get on with that. So they need to be able to contribute as well, to make it a collaboration, as you said, of all three people, or maybe four, when you're talking to the technicians building it, the AI, the patient, and the nurse or doctor who's introducing it in the first place. I think that is the key thing in everything in life, not just this, is listening to each other and taking the best bits from all.
That's brilliant. Well, we have been listening, and we will be taking the best bits from today. So thank you very much, Darren. Thank you to yourself. Thank you, Sharon. Thank you, Nick and Jenny. Thank you for your thoughts, for a really enjoyable conversation. And I hope everyone who's not able to be here can listen in. We'll be sharing this online. And if anyone has any questions to any of the speakers, please send them to info@onthemend.com, and we'll pass those on. But otherwise, it just leaves me to say thank you again for everyone to join today. And hopefully we'll keep in touch and keep this dialogue going, because I think it's an important discussion to go forwards with as On the Mend and other digital health innovators consider bringing new ideas to help patients through what is a very difficult time for them, but hopefully helps to make a difference. But yes, thank you again for all, and look forward to the next event in the On the Mend Webinar World Series. But for me, it's goodbye, and hope you have a good day ahead. Thank you very much. Bye for now.
Thanks so
Bye,
much.
everyone.
Bye.
Bye.